As was said in the previous section on periodontal disease can be defined as any disease affecting the periodontium or supporting structures of the teeth. Periodontitis, however, is limited to inflammatory periodontal conditions, which are characterized by actual loss of the supporting tissues of the teeth. The etiology of periodontitis is similar to that of gingivitis, and it is graphically illustrated in this drawing of a tooth affected by periodontitis. Notice that along the junction of the enamel with the cementum, there is a large mass of calculus. This calculus is irritating the adjacent crevicular epithelium and causing an inflammatory process. The epithelium has attempted to regenerate around the calculus, and by doing this has deepened the gingival crevice. This deepened gingival crevice exceeds the minimal 2 to 3 millimeters for normal healthy gingiva and is called a periodontal pocket. Also, there has been some destruction of the periodontal supporting fibers and the alveolar bone. On this basis, the prominent clinical features of periodontitis can be listed. The most significant clinical feature is the deepening of the gingival crevice to a depth exceeding 2 to 3 millimeters. As the destruction of the periodontal ligament and the alveolar bone continues, there is less and less support for the tooth, and so increased tooth mobility becomes an important clinical sign. The ulceration of the gingival crevicular epithelium by the calculus often causes gingival crevicular hemorrhage. Periodontitis caused by calculus deposition is a vicious cycle, for as the calculus causes the gingival crevice to deepen, there is more room for calculus deposition, causing more gingival crevicular depth recession, and so forth. Also, as the periodontal pocket deepens, the possibility for the patient to clean this area is decreased. This is dramatically illustrated in this radiograph of a patient with marked periodontal disease on the mesial surface of a mandibular first molar. The gingival margin is about normal in height in this patient, but it is almost impossible for the patient to clean this massive periodontal pocket. Occasionally, the destruction of the periodontium by the inflammatory process completely destroys the alveolar bone and gingiva along the labial side of a tooth. This occurs where the tissue is normally quite thin. The resulting area of destruction is called a Stillman's cleft. Pocket formation can be divided into two types, with one type being subdivided. Early in the process of gingivitis and periodontitis, there is swelling of the marginal gingiva. This will cause an apparent pocket because of the gingival crevice being deeper than 2 to 3 millimeters. But there has been no true destruction of the periodontium. This is known as a gingival or pseudo pocket. The second type of pocket is a true periodontal pocket, where there is destruction of the periodontium. If the bottom of the gingival crevice is higher than the crest of the alveolar bone, it is known as a suprabony pocket. If the depth of the gingival crevice is lower than the crest of the alveolar bone, it is known as an infrabony pocket. The therapy for periodontitis is somewhat similar to that utilized for gingivitis and acute necrotizing ulcerative gingivitis. It is imperative that all irritating material be removed from the gingival crevice. This calls for professional scaling of the teeth. In addition, some therapists feel that the inflammatory material from the gingival crevice must be removed, and this is called gingival curettage. Even after the scaling and curettage is done, if the gingival crevice is exceptionally deep, gingival recontouring or surgery must be performed in order to create a gingival depth which allows cleaning by the patient. Occasionally, if a periodontal pocket is unusually deep, the inflammatory reaction will be most intense at the depth of the pocket. If the gingival tissue becomes pressed against the tooth, it may reattach and close off a portion of the periodontal pocket. If the closure is complete, a localized area of inflammation will occur with resultant pus formation. This is known as a lateral periodontal abscess. A very unusual type of periodontal disease is chronic desquamative gingivitis. A common synonym for chronic desquamative gingivitis is gingivosis. Chronic desquamative gingivitis occurs primarily in middle-aged females, although it may affect individuals of almost any age or either sex. The gingiva are bright red, swollen, and glossy in appearance, and there are areas of vesicle or blister formation combined with areas of superficial ulceration. These gingiva are extremely sensitive and painful. This is a most uncomfortable disease for the patient. This is a man suffering from massive discriminative gingivitis of the maxillary gingiva. Now look at another patient suffering from chronic discriminative gingivitis, where the light reflections indicate the areas of gingival destruction. The red areas indicate the areas of ulceration. In the beginning of the process, the ulcers are not deep, but are merely a separation of the gingival epithelium away from the underlying connective tissue. This is graphically illustrated in this drawing. After the vesicle ruptures, there is an area of superficial ulceration, which can become deeper with more destruction because of secondary bacterial infection. This illustrates secondary destruction of the gingival tissue. The etiology of chronic discriminative gingivitis is unknown, and therapy sometimes includes the use of topical steroids, vitamin supplements, and even gingival surgery. Interestingly enough, extraction of the teeth frequently results in a cure. Massive destruction of the periodontal tissue with loss of alveolar supporting bone is most frequently seen in middle-aged and older adults. Occasionally, massive bone destruction of unknown etiology is seen in adolescents. It may be localized to a small area of the periodontium, or it may be generalized throughout the oral cavity. This is a pantograph of a patient age 16 who is suffering from periodontosis or juvenile periodontitis. Juvenile periodontitis or periodontosis can be defined as acute periodontal bone loss in an otherwise healthy adolescent. The etiology of periodontosis is unknown, and attempts at therapy are discouraging.